The healthcare sector of any nation, developed, emerging, or developing, is key to its economy. Like agriculture and education, healthcare plays a dominant role in economic growth. Thus, when the coronavirus pandemic spread across the globe, exposing the challenges that existed in the health sectors of most countries, the global economy was brought to its knees. Indeed, the global healthcare sector had never before in modern history faced a challenge much tougher than the coronavirus. From the United States of America to Europe, South America, and Africa, the challenge was all the same. The health sector required the support of all to enable countries survive the pandemic. In Nigeria, the public health and economic crisis triggered by COVID-19, coupled with a 55% drop in crude oil prices between January and May 2020, necessitated that government at both the federal and state levels had to collaborate with the organized private sector to address the challenge of the time. Hence, the Central Bank of Nigeria, CBN, stepped forward in line with the goal of the Godwin Emefiele-led management to be a people-centered central bank to bridge the gap. Leading the way in a period of palpable fear around the globe, the CBN mobilized the private sector through the Coalition Against COVID-19, CACOVID, to raise over 40 billion naira to address the challenges brought by the pandemic in order to preserve lives, restore economic activity, and reset the Nigerian economy. Particularly, the contributions from the private sector, championed by the trio of the CBN governor, Godwin Emefiele, the chairman of the Dangote Industries Limited, Aliko Dangote, and the group managing director of Access Bank PLC, Herbert Wigwe, went into the construction of isolation centers, as well as rehabilitation of some health facilities across the different geopolitical zones of the country.
We want to now make sure that we have a database. So you can go into that data and now get somebody.
CACOVID, right from inception, has sought to basically help to relieve the issues that come with COVID-19 and also to protect the livelihoods of people.
The coalition equally worked with all state governors, the FCT minister, and the Nigerian Governors Forum to procure, deliver, and distribute food relief items to almost 2 million most vulnerable families across the 774 local government areas of the country. As part of its own response to the coronavirus COVID-19 pandemic, the Central Bank of Nigeria launched a 100 billion naira credit support for the Healthcare Sector Intervention Fund to, among other objectives, provide long-term, low-cost finance for healthcare infrastructure development that would enable world-class healthcare facilities spring up across the country.
The CBN has over time emphasized the need for us to move from a consumer-based economy to a more productive-based economy. To this, the bank has developed intervention programs and schemes across various sectors, including the healthcare sector, as part of proactive measures to support the growth of healthcare sector in Nigeria. The CBN introduced the Healthcare Sector Intervention Facility, which is still not fully disbursed today. The facility is aimed at strengthening the sector's capacity to meet the increasing demand for healthcare and products and services, particularly pharmaceutical companies and other healthcare value chain players intending to build or expand capacity. Currently, 82 projects valued at 85.89 billion naira have been financed through this scheme. The projects financed comprise 26 pharmaceutical and 56 medical projects across our country. It is my strong belief that this will offer the average Nigerian access to much needed vaccines and drugs for not just COVID-19 but other communicable or non-communicable diseases. The CBN is committed to the successful implementation of this scheme. Hence, we will ensure the review of and evaluation of subsequent applications.
The bank also introduced a Healthcare Sector Research and Development Intervention Scheme, HSRDIS, to help strengthen the public healthcare system and finance the research into the development of vaccines, drugs, and herbal medicines for the control, prevention, and treatment of infectious diseases in Nigeria. Research proposals under the HSR-DIS are reviewed and evaluated by a body of experts headed by the Director General of the National Agency for Food and Drug Administration and Control, NAFDAC.
CBN has supported research and development. We are seeing just the output of it. We have not finished our review of the grants, but CBN is also supporting pharmaceutical industry and medical centers because of the weakness that was there for years or for decades. So what CBN is doing is fantastic for the country and is going to move us forward in terms of health security. Without health security, we cannot have a healthy workforce.
The bank went a step ahead by constructing an isolation center and molecular laboratory as part of its efforts to curtail the spread of the coronavirus. The center, which was remodeled from the old CBN clinic, is situated in Garki, Abuja. The center was completed in February 2021 and has three major areas: the isolation building, the molecular laboratory building, and the ancillary building. The isolation facility, meant to support levels 1 and 2 COVID-19 patients, has 12 wards with 30 beds, with each ward en suite. There is also the nurses' station, clinic, health workers' room, and the donning and doffing rooms. The molecular laboratory building features a deactivation room, extraction room, master mix addition, gene amplification and extraction room, records room, and a briefing room, among others. The impressive building also boasts of a sit-out and recreational area for residents, in addition to an X-ray room, security room, laundry services, and an incinerator, among others. During a recent inspection visit to the center, which is just opposite the Diagnostic Center, also recently completed by the bank, the CBN Governor, Mr. Godwin Emefiele, said the bank was committed to delivering a world-class facility comparable to any other first-rate infrastructure around the world.
I'm very delighted that we're doing this, and that eventually at least we can be sure that our staff will have a good healthy environment where in case they're sick they can be cured. You all know what the COVID has done to everybody. It has opened everybody's eyes, and you heard me talking about the fact that it has to be a first-class, indeed world-class facility, where anywhere if you enter this place you will feel like you are in a hospital in any part of the world, or an isolation center that you can find in any part of the world.
He added that the 30-bed facility, when completed, would be fully automated with state-of-the-art facilities, including oxygen plants, to support patients. Besides providing quality healthcare services for the staff of the bank, Mr. Emefiele said the center is part of the bank's corporate social responsibility and would also cater for the health needs of members of the host community where necessary, as well as those of other Nigerians in need of its services. Conducting the governor and his team around the center, the Director, Medical Services Department of the CBN, Dr. Mohammed Ahmed Shehu, said the facility would support levels 1 and 2 COVID-19 patients.
Most of the patients here that will keep what we call people that have mild symptoms to people that are asymptomatic. So that's the concept of this isolation center.
To ensure a smooth operation of the isolation center, which has commenced services, the CBN worked closely with the Federal Ministry of Health and officials of the Nigeria Center for Disease Control, NCDC, who trained staff of the Medical Services Department of the CBN on the protocols and process of managing the COVID-19 pandemic.
Very unprecedented because they have taken us as a special group. Instead of treating other medical personnel in conglomerate, we are being managed as a special group. So at the end of the day, it is expected that we would have batches that would come from the medical service department, all aspects of staff, doctors, nurses, pharmacists, laboratory scientists, and other ancillary medical staff, even including cleaners who are supposed to clean that environment, so that there will be safety, no transfer of infection from the patients to the people that are healthy.
With the coronavirus vaccines now available in Nigeria, it is expected that isolation centers around the country may be underutilized. However, a forward-looking Emefiele said the isolation center would be converted to a dialysis center to provide quality care for patients with kidney challenges. What prompted the CBN to embark on this project?
We thought, instead of just giving this building away, we thought we should convert it into an isolation center. This is with the view to see that we also assist the government in trying to see that all the patients that usually have problems when we look for where to keep patients, we need to go round. And then we said that we should convert this facility to an isolation center, so that at the end of the day, all the patients that would need critical care, both those in Central Bank and the surrounding and the community, will benefit from this facility. So the idea is to go in tandem with what government is doing, with what PTF is doing, trying to see that we take care of our patients, we take care of people that require help, and that also we key into what the government is doing and what the health sector is doing all over the nation and also all across the globe.
Talking about the isolation center, actually the idea came up after this clinic was constructed, and then our old clinic moved into this structure. We were given a directive to now see how we can renovate the old clinic and convert it into an isolation center.
Sitting opposite the isolation center is the Central Bank of Nigeria Diagnostic Treatment Center, which was completed on September 30, 2020. The Diagnostic Treatment Center, otherwise known as the new CBN Clinic, is an impressive 3-story building which features state-of-the-art facilities to provide qualitative care to patients within and outside the bank's stakeholder groups. A short tour of the building shows that the ground floor consists of a record section, 8 consulting rooms, accident and emergency, laboratories, injection rooms, a spacious restaurant, physiotherapy, pharmacy, stores, and an emergency theater. Walking up the stairs or taking a lift to the first floor, you will find the antenatal clinic, family planning and immunization, administrative units, general wards for male, female, and children, 4 private wards, X-ray and CT scan rooms, and a surgical theater. The second floor houses the administrative offices, executive offices, library, teleconference room, cafe, staff lounge, and outdoor foyer. Other spaces include CCTV and ICTV rooms, waiting areas, and a large centralized atrium at the center for relaxation. The ancillary buildings, which support the main building, include a generator house accommodating one 800 kVA generator and one 500 kVA generator and their associated panels, and a transformer dedicated to the site. A second building houses the medical oxygen gas, boilers, and fire pumps. Other facilities are a borehole, water tanks, diesel storage, and outdoor stores. There are also ample parking spaces for staff and visitors parking, as well as an ambulance bay. The entire facility is secured by an electric fence, nurse call facility and telepresence, CCTV cameras, electric gates, and a fire detection system.
It's really quite impressive what we have seen, and things that need to be in place in an isolation center, in an ideal isolation center. I would say we have over 90% on ground. in this facility. The organization actually thought of everything, and they went the extra mile to ensure that these things are on ground. So we're really, myself and my team are really impressed about what we have seen, and I think they're good to go.
Now that the hospital is fully equipped with state-of-the-art hospital equipment, the Director of Medical Services Department of the CBN, Dr. Mohammed Ahmed Shehu, says the CBN Diagnostic Treatment Center is ready to care for patients. With this huge imprint in the health sector, the bank has proven yet again, in the words of the CBN Governor, Mr. Godwin Emefiele, that today's Central Bank of Nigeria is a people-oriented central bank.